this is what I'm going to enjoy. My mentor is Freddie Carlton-Bourne. And Freddie, in his latest book, he sent me an autographed copy recently. He's 85, bless him. So Mackenzie and I each sent him a special card because he got us cracking in manual therapy. But Freddie justifies everything he does by biomechanics. Now, you've got a joint, and when it flexes like that, he says that the facet goes down as it flexes. So if you've lost flexion, you push that facet down, because biomechanically that's what happens. And that's really the rule for every treatment. And many years ago in Germany, the insurance companies wouldn't pay for Maitland treatment, because Jeff never really said what he was doing. He told you what to do, but he never really said why. And Freddie could go to the insurance companies and the doctors in the insurance companies and say, when somebody cannot bend their wrist, those carpal bones go down, so our mobilization is to move them down to increase flexion. And that's what's in his book even today. Now, I'm hoping that people in this room have a scaphoid problem. And when you extend your wrist, the scaphoid goes down. And you can feel the scaphoid in the snuff box. When you extend, you can't feel it. And you'll find that if there are people here with scaphoids, half of them will get better by me lifting the scaphoid up while they extend, and the other half will get better by pushing it down. In other words, you go in the direction that needs correcting to put the surfaces where they should be so it will now function normally. And to say you follow a biomechanical rule, well, you'd never treat a scaphoid if you stick by that rule. It doesn't work. And the very first time I ever did it, mobilizations for me began many years ago with a finger. And a girl had a grossly swollen finger after playing basketball. She caught the ball and it was swollen. She couldn't move it. And I did every technique that I taught in New Zealand on her finger. Nothing worked. I tractioned her and I pushed it down. Nothing worked. And I remember just doing a translation. Oh, I went the other way. Oh, it doesn't hurt, she said. I said, can you bend your finger? Oh, she said, I can bend it. Oh, I said, of course. I'd never done it before. But my goodness, what happened? So I went and dreamt about it. Now, why do mobilizations with movement work? My explanation is the simplest one of all. You have positional faults. And by correcting the positional fault, it restores normal activity to the joint. Now, you'll see tomorrow that we've got proof that there are positional faults with ankles. They've just done a study on shoulders, and it was done by Australians, and the outcome was that what they did to the shoulders tends to prove Mulligan's hypothesis that there are positional faults in the shoulder. I thought, that's very good. They're learning. But I believe everything works. And if you work on that assumption, you'll think about all joints that you see and think to yourself, now, how can I alter the position of those surfaces to see if it'll work for me? And that's what I did. I went right through the body, I looked at every joint, and I fiddled around till I found there was, in fact, a procedure for every joint in the body that you should be aware of, and you should try if you've got some problem with a joint or a function like walking. Now, who has got pain where the scaphoid is in the wrist on the thumb side when you extend or flex your wrist? There must be 5 or 6 people in this room. Yes, do come out, that's number 1. Oh, and you have 2 with the coffee. Come out. There's 2 straight away. The others are going, yes! The others are going to wait and see how we get on. Now I'm really getting excited. What hurts?
Mine hurts when I do a push-up.
Oh, goody. Now, if we get hold of your hand and we push it back, does that hurt?
It will in a minute.
15, 60. It's starting to hurt, look. Now, what I'm going to do is get hold of a scaphoid and move it up and down and see if I can detect a discomfort in one direction or the other. Now, the scaphoid is a unique bone because it's the only bone I know of, you might know of one, that is concave at each end. Usually, most bones are concave at one end and convex at the other, but the scaphoid is concave convex where it articulates with the lower end of the radius, and it's convex where it articulates with the trapezium. Now, I'm getting hold of a scaphoid, so I fixate, first of all, I fixate the lower end of the radius, and can you feel me on that bone there? And I push that down. Does that hurt?
A little bit tender, yeah.
What about that way? See, every time you try these, one direction is sore and one is not. Now the sorry. These normally have Mulligan mobilization pad, and every pack you buy, I get a royalty. Now, these are very special. These do things that nothing else will ever do, so you should all have them. Now, he's a bit tender there, so I'm going to do it through sponge rubber. But initially, I'll do it without. That hurts when I go down. Now, isn't that interesting? Now, Freddie, in getting that movement back, would push the scaphoid down. No. We are going to lift it up. Got to get on it first. Now, just bring that back. Now, if we just hold that, just tell me if you get any pain.
No pain.
Yeah, keep going. That's why I had to grow this little bit of an abdomen. So, you know, it's not because of gluttony. Did you think it was?
You're not an American.
Miller Lite. Yeah. Just try a press up just for a minute. Just. I'm getting death. What did he say? Oh.
A little stiff, but...
Any pain? Yeah, all right. We only did one. Well, I'm hoping that would work. If it doesn't, I have to do it while he's lying down. You know, because I really have to sort of get it positioned and then say, try your press up. And that's not easy to do. But I'm going to come up again with that. Whoops, I'll do it this way. Use the sponge. All right, come on, down on your hands and knees. Now, he is very good. He's putting his hand in the neutral position first so I can reposition. If he goes to end range, I can't move anything. All the structures are tight. So he's putting it in a neutral position spontaneously. So he is much more intelligent than he looks. So here we go. You right?
Yes, sir.
Now just try that and just see if I'm somewhere near. Talk to me.
A little bit of discomfort.
I'll try the other finger right there. Off you go again. Pretty good?
Yeah.
Yeah! And let go. It's quite easy, as you can see. Oh! And let go. Yeah. I've got my index finger, the tip of it, around on that scaphoid, and I'm moving it in this direction, and I'm pushing his lower end of the radius in the opposite direction to reposition. There's that pushing that way. You can feel that, and you can feel me pulling that up. Now, off you go again. How's that? Pretty good. Now, do a press up. Come on, go down a bit. Just do 20 and have a rest. My God, he can do them. Stop, stop, stop. I won't do press ups because it'll embarrass them. Do another press up.
The other one.
Do another one. And I should have done 3 sets of 10, but he's not. Have you got your checkbook?
Yes.
Oh, all right. Well, I'll do the 3 sets of 10 and charge him. Now, wait on. I can do it. I've shown you I can do it. I'm just going to the back of the room and I'll get someone. Right. I'll go through it with you first. You're allowed to sit down, all right? You're going to hook that on a scaphoid, and you're going to hook it. The thumb's going to be on the lower end of the radius where you can push it that way, and this is hooked up. You can feel me hooked under there. Now, can you just hook in the same place? Just It's under there, and there, and he'll tell you if you've got it. That's right? Good. Now, he's just positioning his hands now so he knows what he's going to do when he puts his hands on the floor. Now, put your hands on the floor for your press-up situation, and you've got to keep your pressure on your knee and pushing with your other thumb. How's that? Woohoo! You'll get stronger as you get older, so don't get discouraged. Has he got it right?
Close.
No, he's close because it's a very small bone and you've got to be exactly on the right spot. You've only got to be a 16th of an inch out virtually and it won't work. He'll tell you.
Which finger is applying the pressure?
Underneath my index finger is pulling the scaphoid up on the lower end of the radius, and the thumb is pushing the radius the other way. So, yeah.
So his left index finger is...
His left index finger is underneath, pulling it up.
So, does that work in open chain as well? So you hold radius, and you move it, and he moves it.
Yeah. It does work in an open chain. I'd certainly use this procedure because that's when his symptoms exist. He does press-ups, you treat him. If people have got a sacroiliac and it hurts when they walk, I treat them while they walk. And I hope tomorrow someone's got a sacroiliac. Anyone got a sacroiliac that hurts when you walk? Oh, well, you'll probably get rid of that tomorrow. Oh, look, it's so exciting. Look, you've got to stay. You've got to come tomorrow. You've got to be here for 2 days. We've got 10 minutes, yeah?
But could you explain that by, because he's in a closed chain and he's fixating scaphoid, he's actually gliding radius ventrally. That follows Freddie's rule.
No.
Yeah.
Freddie's rule is that the scaphoid goes down in extension.
Right.
We're taking the scaphoid up in extension. We're pulling it this way.
Biomechanically, though, his rule goes with the concave surface.
Oh, no, I don't go by concave surfaces.
Okay.
Here.
You have a concave scaphoid, and you're moving the proximal joint, the radius, which is convex.
Yeah.
You're gliding and rolling in the opposite. In that, you see what I'm saying? So
yes, I know what you're saying.
So that would follow his rule, but in an open chain environment.
Right on. Let's get this right. There's the scaphoid, which is that shape, and there's the lower end of the radius, which is that shape.
Okay.
Now,
this is a radius, and that's a scaphoid. You said
no. That's the radius. That's the scaphoid. That surface is convex. That surface is concave.
I see what you're saying. Yeah.
Now, in extension, that goes down, if you like, and that comes up. Well, we're taking it that way. We're doing exactly the opposite of what normally happens. Normally, that goes down in extension, and we're making it come up, because this is where the extension is.
Gotcha.
So I'm making it come up. Freddie would take it down. But half the patients, you go the other way. What I'm saying is you don't know which way to go till you reposition one way or the other. So you don't have to think about a concave, convex. You just go in the direction that is pain-free and allows movement to occur. Yeah? No, that was good, because I think everyone had the same thoughts. But it's not that that's moving when he's doing a press-up, it's the wrist.
What would be a long-lasting effect for you?
What long-lasting effect?
Right.
It is forever.
Well, if he comes back next day and let's say he could do now 5 push-ups, but next day he can do only 1 with pain-free, that would be a...
Yes. Now, look, that's a pretty shrewd and pretty clever question. No. My neighbour, for instance, that has a dislocated finger, he can't bend it. As a result of what I do, he can still bend it. The other one that hadn't moved his thumb for 2 years can still bend it the next day. He had a little bit of pain, so we had to do a few more. Now, hopefully, they're not completely better, because you can give them more treatment. The trouble with these stupid treatments is the best way, if you've got a scaphoid, if someone comes in, I've had this for 2 years, I can't do press-ups, you give them 2 weeks daily of ultrasonic to prepare the tissues for the next procedure. Now, you've filled this up. Now I think we're ready to try something revolutionary. And so, away you go. But it's a good question, because I would like to know how he is tomorrow. Yes, my dear.
As you know, with Maitland, you usually go with the direction of movement, the comparable sign.
Yeah.
And here we're doing the opposite. How would you...
Well, when you say go with the direction of movement, the direction of movement for him was when he did a press-up. That's the movement, isn't it? And that's the movement. That's what we're doing. That's the direction. We're going in the direction of movement that gave him symptoms.
But if you particularly move the joint, and your comparable sign was to move the scaphoid, let's say, downward to cause the pain, Maitland will go with the downward.
Yes! Now, that is very, very interesting. And patients used to say, I'd get hold of her. Let's say he's got a finger. And I'd go there, that hurt? No. Oh, you found it. Yes, that hurts. Oh, you know what you're doing now. Good. And that's how you treat it. No, I don't. I go in a direction that doesn't hurt. Now, there is an exception to that rule. And in my book, I talk about PRPs. And quite often, if you provoke a pain at a tolerable level, and you keep provoking it, it disappears. And that's a whole new ball game. It's quite exciting. But no, that's where I differ totally from Jeff. Totally from Jeff. But I don't think Jeff would get the results as quickly as you're seeing today. Someone here hasn't done something for a year or 2 years, and we're getting a result now. Not a week later. All these things, we're getting instant results, which isn't a good move. That hurt?
Yeah, it hurts me.
Right there, and right where the scaphoid is, and both ways. Now, she's got pain in both directions, but that makes no difference. If you've got a positional fault, now that's that raises another issue. You've got a positional fault, the lower end of your ulna on the radius, and you've lost supination and pronation. You push it down, and you get supination. What direction do you go to get pronation? The same. Because if it's a positional fault, when you've corrected it, you'll get both movements. If you're treating it biomechanically, you go down for supination and go the other way for pronation. No. Now, she's got pain in both directions. So we take this down. Does that hurt? Mm-hmm. What about up?
Not as much as down.
Not as much. Now, when she says not as much, this is the difference between someone who's not used to the concept and someone that is. I'm not going that way. That way is not as painful. So now I'm going to come up in this direction, but I'm going to keep changing that direction minimally till I get a position where there's no pain at all. So you feel that there? Not really. What about that way? No, already, because we're going in the right direction, she's not starting to feel it. Now, is that okay? Mm-hmm. Yeah, that's great. Now, which movement would you like first? Backwards or? Extension, right. Now, come slowly. Now, if she comes back quickly, I mightn't be able to keep on the scaphoid. So there we are, back you come. Back you come. Now, is that all right? Mm-hmm. Yes, overpressure. And I've kept that on, haven't I? Any pain?
I feel that a little bit.
She feels it a little bit. So I'm going to change imperceptibly the direction so she feels nothing. Now, it might take me just a... Now, come back slowly. Now, just try that and see if that's better.
That's a little better. That's a little better.
That's a little better. Now, there we are. That's $35. Did you hear that? Click. Right, back you come again.
I still feel it.
All right, now, wait on. No. Try now. I'm just going to fiddle around till I get it. I will.
It feels better.
That feels better. Good. Das es viel besser. I've got to speak in Germany next year, so I've got to practice that as well. Up again.
That's good.
That's good, bless her. Do you know she's better because her smile changes. She had a painful smile the first time. And then her countenance changes. And off you go again.
Okay, that's good.
There, that's good. Oh, now go down. Would you hurry up?
A little bit. It's better brain, but I can still feel it.
Right, let's go slowly.
I don't feel anything.
You don't feel anything now. Look, I can so easily get off the target, so I fiddle around till I get it exactly right. Just pull it back again.
Just feel a little bit.
Yeah, just a little bit. Well, she hasn't had 3 sets of 10 yet, but damn it, you got a wallet? All right, back you come.
Okay, extension or flexion?
Yes, extension, yeah. Yeah, and again. Now, would you be able to do a press-up without pain, normally?
Mm-mm.
Oh, no, all right, come on.
I mean, I can't even weight bear on my hand. Just sitting.
All right, we'll try. She can't even weight bear on her hands normally. Wait on, whoa, I haven't got it. All right, now try it. Yoo-hoo.
It's more flexible. I mean, it's not that bad at all.
No. Let me get it right. All right, off you go.
Just feel a little bit. Tell me where to go.
Yeah, now go. All right?
I mean, I can feel it's not a sharp pain. I mean, usually I couldn't.
Yeah.
Did you narrate, she said? Narrate while you
Yes, I will. I'm going to get a bit of sponge. It's rather, her hand is harder to move doing this than the guys were. She's got quite a thick wrist just there, haven't you? Where's my bit of sponge?
Narrate.
Now, right on. I'm going to use my middle finger underneath. It might be a little bit stronger and a bit more tolerant to the pressure that's going on it. Now, I'm taking the scaphoid towards me and I'm pushing the lower end of the radius in the opposite direction. Now, just try that gently and see how we're going.
Well, I don't feel the movement as much. I just feel your
Pressure.
pressure, but that's fine.
Yeah, but the movement doesn't really hurt at the moment.
No.
No, and when I hold that scaphoid up on the lower end of the radius, she doesn't feel any pain. And if you do those repetitions, she will get better and better. And you should really do 3 sets of 10. How long has that been a problem?
Well, it started when I started doing percussions 20 years ago when I became a PT. So, and then it's just gotten worse the last 2 years. I haven't been able to wait.
She's had it for nearly 20 years coming and going, and it's got worse as the years go on. And sometimes you can get a little bit of tape and you can hook the tape underneath on the scaphoid and you can lift it up and wrap it obliquely round, hoping that it just repositions it enough to make a difference, so that every time she uses it, you've got a mobilization with movement being undertaken because you've repositioned the surfaces as she moves it. Here we go. Now, underneath, I'm putting the tape on the scaphoid. You feel I'm on it there? Now, when I lift that tape up, or lift that scaphoid up, I'm going to ask you to wrap this obliquely around your wrist.
All right.
So see, well,
See when.
now, hard as you can. Yeah, good girl. It's good, of course. It's not moving it very much, but it's enough to make a difference. And I normally would put a second piece on top just to reinforce it. So let's do that. And then, I'm sorry, we're 3 minutes over. So rush out. Now, watch where I put it. I'm under there, where the scaphoid is. My index finger's going on that scaphoid to take it in this direction. You're going to grab the tape. I'm going to fixate. Up we go. And across you go, bless you. Yes! Good on you.